Knowing how to talk to your patient is the key to providing them with the right treatment as well as helping them cope with their current situation. There are different kinds of communication. Verbal, which is the spoken language, and nonverbal, which is everything else. It includes your posture, voice, tone, etc. How you communicate with your patient should match what you're saying. This is called congruence. However, if your tone or body language does not match your words, this causes confusion and is known as incongruence. We are going to show you the best way to reach your patient as well as giving tips on things to avoid. To show empathy and interest, make aware that your presence is there for your patient. This will let the patient know that they don't have to act out to receive attention. There are two types of questions, open and closed. Open questions leave a lot of room for a lengthy response. It allows patients to clarify their thoughts and voice their attitudes, concerns, and their feelings. Closed questions just leave very little room for a response. Verbal communication can be therapeutic for the patient if done correctly. However, there are some things you should try to avoid. Next are examples of probing, advising, false reassurance, and changing the subject. Probing may offend the patient and makes it seem like you're prying. Try to suppress your curiosity because it ultimately doesn't help the patient. Try to ask questions that focus on finding out what ails them. False reassurance suggests that there is no need for any anxiety and belittles the patient's feelings. It is basically lying to them and should be avoided at all costs. As we all know, verbal communication is only a small fraction of how we get a message across. There are hundreds of other cues that we give off outside of simply speaking. Body language, eye contact, personal space, and voice tone are just some of the things that can either help or hinder a nurse's ability to get through to her patient. Different situations require that we adjust our communication accordingly. Sometimes it's difficult to keep track of every movement that you are making. However, there are some simple things that you can keep in mind to maximize communication.